Senator Hunt, you're recognized to open on the priority motion.
Thank you, Mr. President. Good morning, Nebraskans. I can tell you a little bit about my intentions with ordering the motions and amendments that could potentially come up on LB669 with my time on this motion before Senator Storer introduces the bill. I understand from stakeholders, proponents and opponents, that there are some negotiations in process with a potential amendment. This is a really great thing to have happen on a Friday. I love it, right? Like when there's work to do and it's Friday, because then we have some extra days to get that done. So my intention today is to use this motion to state some of my opposition to the bill as it stands today, understanding that Senator Storer is working with stakeholders on both sides of the issue to continue the effort to come to an agreement, and that gratefully we don't have 15 minutes to do that, as we sometimes do on this floor, but we have several days to do that, so that's a really good thing. LB669 is a bill that's being framed as a measure to protect victims of coercion and trafficking and violence and abuse, and those are very serious issues, of course. They deserve serious evidence-based responses, and they deserve policies that are truly responsive to the experiences of survivors, that strengthen access to services, and that also in the context of medical care reflect medical best practices. And I know that Senator Storer agrees with that. I'm in disagreement at this time with the solutions that LB669 sets forth to accomplish that. And I can outline some of my opposition to that on the record here for Nebraskans who are watching as we continue to work on this bill. This bill singles out one group of patients, which is people who are seeking abortion care, and treats them as though they are uniquely incapable of making their own medical decisions. It builds a narrative that abortion itself is a site of coercion, when the actual evidence shows something very different. You know, we see that women are often coerced into getting pregnant, into staying pregnant. There's things like birth control sabotage. There's forced pregnancy as a tool of abuse. And this is also a type of coercion that, if we're serious about helping victims, survivors, you know, allowing women to be in control of their own reproductive destiny, and free from violence, we have to look at that side of it too. So what this bill focuses on is just those in Nebraska who seek abortion care, kind of painting with a broad brush and setting an expectation culturally that a lot of these people have been coerced into getting the abortion, and that does not reflect what reality really is and what the data says as well. Coercion and intimate partner violence are real and devastating problems, and human trafficking is real, and we agree that survivors deserve compassionate, confidential screening from their healthcare providers when they seek support for those things. But coercion around abortion is a very, very small piece of a much larger and more complex problem of domestic violence and reproductive coercion. Research shows that while a small percentage of pregnant people report pressure to end a pregnancy, there is far, far more pressure, you know, infinitely more pressure to not seek an abortion, or to report birth control sabotage or forced pregnancy, these tools of abuse. And in other words, reproductive coercion most often shows up as someone being forced to become or stay pregnant, not forced to end a pregnancy. Yet LB669 focuses narrowly on abortion patients as if that coercion only flows in one direction. And my problem with that is that misleading, it's incomplete, it doesn't reflect the facts, and it doesn't reflect medical consensus. And it also pulls attention away from the broader systems that we need to be talking about reforming to strengthen the policies that help survivors of domestic violence. If the legislature is truly serious about policy grounded in survivor protection, we would be having a very different conversation today. And we would see a lot of policies that we've worked on over the last years had come to fruition. So my concern with the way LB669 is written is that, you know, ostensibly it's about protecting survivors from coercion of domestic abuse, from terminating a pregnancy that maybe they don't want to terminate. But in doing that, it continues to cast a stigma over abortion care when really that coercion goes both ways, and it's really important to name that if that's the goal of this bill. I think that other things we could be talking about include universal trauma-informed screening for domestic violence and trafficking in all pregnancy-related health care, not just abortion. If we were serious about this, we wouldn't just be talking about abortion providers, we'd be talking about all obstetricians, saying, we're going to have a screening for patients saying, were you coerced into keeping this pregnancy? Were you coerced into ending this pregnancy? Just taking a temperature of what the level is there for those patients. And what we heard in committee from healthcare providers, and what healthcare providers who have reached out to our offices since this came out of committee has said, is that these are things that they already do. Both abortion providers and obstetricians and other healthcare providers, they already have these screenings in place to make sure that their patients feel safe in the exam room and are experiencing safety in the world as well. In line with the medical standards of care and recommendations from major healthcare organizations like the American College of Obstetricians and Gynecologists, the American Medical Association, providers already screen patients for coercion, domestic violence, and trafficking as part of confidential trauma-informed care. Staff is trained to recognize red flags. They know how to have these conversations privately and safely. They know how to connect patients to resources. And this is something that's already happening because it's already standard medical practice. Even proponents of this bill acknowledged that in the hearing. So what LB669 actually changes from what's currently the standard of care, what providers are already doing, is it adds arbitrary hurdles for healthcare providers, and it also inserts some problematic ideological junk science language into statute. One big problem, number one, under this bill, patients would have to sign a written certification that they were asked these questions by their healthcare provider and given resources. And that might sound minor, but the problem is the signing of the paper. For someone who is being abused, coerced, trafficked, a written record like that can feel very dangerous, and it can make them much less likely to disclose these things than a conversation. Research shows and experience shows that survivors often fear documentation that could be found by a partner, that could be found by a trafficker, that could ever be subpoenaed in some way or used by an abuser. And if we truly want victims to speak up against their abusers, we should be removing barriers to confidential disclosures, not creating new ones and adding bureaucracy. And I think that that's a part of the negotiation for an amendment that's going on right now, so that really pleases me. LB669 also includes these really sweeping general statements, such as in Section 1, subsection 8, claiming that, quote, many pregnant women are coerced into abortion. And that claim is not backed by credible evidence or any research, and it reflects talking points from anti-choice organizations, not the consensus of medical or public health experts. Embedding language like that, many pregnant women are coerced into abortion, embedding language like that into statute politicizes what should be a careful, evidence-based discussion about survivor safety done by experts, not by partisan politicians. Would it be better to say something like, many pregnant women are coerced into abortion and many women are coerced into pregnancy? That would put both sides of it on there, but I don't really think that we need to have a finding about that at all, in my opinion. This bill overall rests on a harmful assumption that people seeking abortion care are uniquely vulnerable, confused, incapable of making their own health care decisions without state-mandated intervention. And that's a stereotype, and it's not true at all. Research shows that while a small percentage of pregnant Nebraskans, pregnant people, report pressure to end a pregnancy from a partner or an abuser, far more women report pressure to seek an abortion or to end a pregnancy or to not seek an abortion, to have birth control sabotage, to get pregnant, basically. Far more women report being coerced into that. And if the legislature wanted a policy grounded in survivor protection, we would be having a very different conversation today. And I look forward to that conversation continuing over the weekend, and I'm happy to see where we end up on Monday. Thank you, Mr. President.
Thank you, Senator Hunt.